I will share my screen. Let's see here. Oops. All right. Is it in presentation mode? Okay, perfect. So as Berenice said, I'm sure some of you know me in different capacity, but today I am here with Harmony Health Consulting to talk about budget cuts and importance of social drivers of health, very specific to ECM and community supports. I want this to be an opportunity for us to kind of all engage and talk, and I don't want anyone to feel that they have to hold their question to the end. So you could either raise your hand or Berenice and Memo will be able to look at the chat and kind of support in making sure that we get to your question or your comment. These are difficult topics, especially, in light of, all these budget cuts and how our community is being affected. So having said that, my icebreaker today is if we have enough time, and I know some of you may not feel comfortable or are eating, so I want to also honor that. This is a learning circle during lunch, but those who are willing to share their name, their agency, and what brings hope during these stressful times, and I'll kind of mirror it. I'll popcorn it to Berenice, and then we can go from there. So again, Darlene Torres Vaz with Harmony Health Consulting. And one thing that brings me hope during these stressful times is the opportunity to collaborate and to hear from our community and use that in a way that helps make change. So that's what brings me hope. And so I'm going to popcorn it to Berenice.
Thank you, Darlene. Hi again, Berenice with HIP, and I'm gonna have to echo you, Darlene, and say that yes, collaboration is probably what brings me the most hope in these very stressful and uncertain times. And then also just having a little one at home, I think is really helpful, and having him be like my little office manager since I work from home, and he'll come to my desk at 5 and be like, okay, mom, it's time to transition. And I'm like, okay, yes, I will transition now. And I will popcorn it over to Steve.
Hey y'all, Steve Weiss, ECM Program Manager for Community Bridges. And boy, what does bring me hope? What brings me hope is knowing that there are so many people that are working across the divisions. I don't know if there's a better way to say that at the moment, but when you think about the civil rights movement and the women's rights movement, it took more than, people just being siloed with respect to their sex or their race or their ethnicity. They crossed those lines and they worked together and built power together. And I see that happening in our community or in our society, that more and more people are building that kind of power. So that's encouraging.
Beautiful. Who would you like to popcorn it to, Steve?
It's a great question. Could you suggest somebody for me, actually?
Oh, sure. Maybe someone with a camera on, since, let's see. Berenice, can you help me since I'm on speaker mode?
Yes. Let's see. Well, the only other person on camera is Memo, and he's also with our team. So if you want to go Memo, and then maybe we can have folks who are ready to share raise their hand, and that makes it easier to call on folks or share in the chat. There is one chat from Alex Arce, if I'm pronouncing that correctly, with Santa Cruz Probation, and they say all the supportive and positive people that they work with, and knowing that we're all in it together.
Thank you. That's beautiful. Yeah, and that's okay. If anyone wants to get off speaker and introduce themselves, that's okay. If not, then we could just move forward. Samuel, would you like to go?
Sure. Yes. Samuel Griffith, Health Project Center, Chief Program Officer. Working with a lot of like-minded individuals and organizations. I think that's what brings a lot of hope to the communities and myself.
Wonderful. Thank you. Anyone else before I move on?
Oh,
Again,
can I
like
pick somebody? Oh,
Oh,
okay, never mind.
you can pick Mariana.
Yes, there we go.
Hi, everybody. My name is Mariana Garcia. I'm a community supports coordinator with Mom's Meals. We're a medically tailored meal provider. And I think what brings me hope during these times is I love being out in the community. So all the in-person events that I get to attend just really makes my day a lot easier and a lot nicer getting to interact with everybody.
Thank you, Mariana. Maybe one more, or if not, I can get started. Going once, going twice. Thank you for those that were able to share, again, recognizing this is our lunch hour, so want to be mindful of that. All right, let's see here. Oops. So these are definitely difficult topics to discuss, and we all have been researching, we have been informed, we have been reading about the different Medi-Cal and Medicaid cuts, but I think that talking about it in relation to community supports and ECM is kind of something that is beneficial, because I'll be talking us through some concrete ways that we can support each other, but also just wanted to give some general information about, you know, these public benefits and how they're obviously affecting our undocumented community, Tri-County, I mean, nationwide, but very particular. I'm going to be speaking to our Tri-County, San Benito, Santa Cruz, and Monterey County partners. And in general, though, we have seen that 1.65 million undocumented Medi-Cal currently are enrolled, are at risk of losing their benefits. And so I think that education, and you'll hear this constantly through my presentation, education and collaboration and streamlining of messaging is going to be key to making sure that, you know, these numbers don't change too drastically. And one of the things, again, in some of the collaborations that we've been participating in, we are recognizing that there will be higher costs to some of the services, again, from our clinics, our FQHCs, as well as some of our partner agencies and the services that they're providing. But really being able to identify our efforts is going to be very key to this process. I have this chart here, and it's daunting if you look at all of it in its entirety. But what I do want to focus on are 3 very specific dates on here. And again, just to remind everyone, if you have a question, please, you can raise your hand, you can unmute, you can write it in the chat. Because I'm on presentation mode, am not able to see it quickly, so I'll have the support of Berenice and Memo to kind of make sure that we address those questions. December 31st, we've all heard it, and believe it or not, it's hard for me to grasp it, but tomorrow is October. We have 3 months to get this message out. That it is the deadline for those who are interested in still having full scope coverage and are undocumented. So again, deadline, we want everyone to know it. We want it memorized. This is the last day for those who aren't insured to enroll in full scope Medi-Cal. Okay. I don't know if anyone has questions about that, or oops. Okay, here we go. All right. In addition to that, what that means is January 1st of 2026, full scope enrollment freezes for those undocumented individuals 19 and older. So if we have not enrolled them by December 31st, all new enrollments 19 and older are frozen. Okay. They've also included or reinstated the asset limits for those individuals. It's 130K, and then for a couple it's 195. So just, you know, something to also recognize if someone has property or, you know, in savings. Those are things that might preclude them from being enrolled in Medi-Cal. And then again, DACA recipients will no longer be eligible for insurance through Covered California via the marketplace. So those are the big ones, December 31st and January 1st. We will say that another one that's crucial to our community, especially because diabetes being one of the most prominent chronic conditions of our Latinx community, is diabetes. The elimination of dental benefits, mental health services, and long-term care for undocumented individuals 19 and older ends on July 1st, 2026. So if we have patients, community members, clients, whatever we call them, wherever we're seeing them, if we know that there's some chronic conditions that they are trying to manage, that we identify that, you know, they should probably try to get their dental services completed before then, so that it's not a gap in some of their care that they're getting. And again, these other dates, they're there as identifiers, but there's a lot that can change along this way. So I didn't want to emphasize these other dates as much as I did those three. All right, so again, there's some other changes. Retroactive Medi-Cal coverage. So prior, you could go back 3 months for retroactive, and starting January 1st, 2026, they are limiting it, excuse me, the coverage retroactively for only 1 month. So that's a big one, okay? And then open enrollment has changed from 90 days to 45 days. Very small window for those who are still wanting to apply, to be able to get their documents in. And as we recognize for our community, sometimes finding their documents can be difficult. So those are things that we have to keep in mind when working with our clients, community members, or patients. And then there's no major for those who are currently receiving funds through Covered California. That grant will remain the same until their 2027-2028 grant application cycle. So no major changes there other than the DACA recipients. Any questions before I move on? No? Okay. All right, so Tri-County again, San Benito, Santa Cruz, and Monterey County. Obviously, loss in coverage is a concern. Chronic conditions, the ability to manage their healthcare is going to be something that we will see. We've already seen the increase in ICE activity in the state of California, and we are hearing the fear that our community has around ICE, and just in general, going to school, going to work, just being in the community. We've noticed, you know, decrease in participants in certain food distribution sites. There's just been that impact, and being here to hear our community and acknowledge their concerns is going to be very fundamental to the work that we do. And of course, we're seeing a reduction in those in working in the agriculture, hospitality, and service industry. One of the things that we are also seeing is nonprofit agencies really wanting to support with legal services or create partnerships. And so that's so important to this work, especially when we're talking about our Pajaro Valley collaboration. They've done an amazing job of ensuring that they have legal services, several different attorney support in the efforts that they are providing our community. And then again, our healthy safety nets with our, you know, FQHCs and clinics to ensure that while there may be gaps in insurance, that's not a gap in actual services. All right. The entire reason that Central Coast Alliance really started working with their partners on ECM and community supports was really this high utilization of hospitalization. And so we have seen the impact with all of our partner agencies in reducing hospitalizations. So of course, on the other side of that, if we have more of our community members not having access to insurance, those numbers may increase again. And those, especially with chronic conditions or maybe an unmanaged, an unmanaged condition such as diabetes, they may not have access to medications, and we'll really need to support them with, at no cost medication programs or at a low cost. We are also seeing, and this is where it gets concerning, obviously we have a lot of amazing partnerships with CBOs, and the risk of them not wanting to provide the same service because of the budget cuts. But really, I think the education piece, and we'll be talking about this a little later, will support us all really streamlining what we're saying so that those that still are interested and want access to Medi-Cal are still able to have it. And then, of course, equity is always a big one. Equity and trust, and making sure that when we are relaying these messages that we're doing in a way that's very humanistic and, supporting the fears and reducing fears while supporting, their concerns. All right. So I'm so proud to say that I work in this Tri-County because, as many of you said, I think Steve, you said it as well, it's like the individuals that work and do this important work are really collaborating. And so we're seeing this at various county level kind of meetings where people are supporting, making sure that the message is similar across a CBO, an Office of Education, whatever the case may be, that the message is similar. So in addition to that, there are clinics that are now looking at expanding their services. Many of you know that in Watsonville, it's currently difficult to identify a clinic that has openings for the 19 and over population. So we're hearing that a lot of our medical centers are looking at ways to increase access by hiring new staff and making sure that there's expanded hours and ensuring that our community does not have that as one of their barriers. And we also have in these collaborations found that the advocacy and legal support has been instrumental to the work. I will say that, we've done a great job as a collaborative to support, the child safety plans and how that went, and this call to action to ensure that we are advocating and preparing our community for, things that may be here in the future. And just really raising the public awareness is so fundamental to the work we do. I mean, these are all things you all know, but again, I'm very proud of our collaboration to make sure that this is happening. And then one of the things, if you get anything from this presentation, is that we need to treat Medi-Cal as a health access issue and not just a paper that needs to be done. That we create systems, that we embed them into our ECM and community support touch points, that we are ensuring that during a social driver of a health screening, that this is something that's addressed. We just want to make sure that patients don't fall through the cracks and that we're still able to provide this amazing case management and community supports kind of services. This is work we've been doing far beyond, when we could bill, but the opportunity to bill now provides us with even more access. And so we want to make sure that our community is educated. They still have to make their own decision of whether or not they will participate, but educated on what's out there for them, and especially when it comes around Medi-Cal renewal. One of the things that we are seeing, and we have an amazing managed care program through Central Coast Alliance for Health. They are already sending out text messages and mailers about renewal deadlines in multiple languages. So I think that if one of the things you could do as a partner agency is do kind of the same messaging that Central Coast Alliance for Health is doing, or something similar, by creating pamphlets, by sending, you know, those voicemail reminders or a text message, that would be important to us to make sure that we're not losing those patients, again, that are identified as having high acuity and needing these services for the individual as well as the family. I think it's important for us to be able to explain in plain language what redetermination looks like, what is required to complete the paperwork, and where they can get the help. So again, those are concrete things that we can do. There are ways that we can support making sure that the education is out there. Attending health fairs, tabling at different community events, just normalizing the conversation about Medi-Cal renewal is going to be a valuable tool. All right. So I think that this one is not as easy task to do, but if possible, having your staff, your community health workers, your promotoras, you know, other staff that are interested in becoming certified enrollment counselors would be beneficial as well, so that your agency can be identified as a place to go and complete these documents. And again, it's medical centers, it's CBOs, it's schools that are out there and stating, we do have staff that can help you when there's you know, literacy issues. I think that also coordinating with the Alliance and coordinating with our county eligibility workers on making sure that the documentation is clear, that the expectations are clear. And then again, having this amazing managed care program, we really can lean heavily on the liaisons to support us and provide us with literature if, for whatever reason, creating our own is something that's unrealistic. And technology is also very difficult. We're finding that a lot of times the county portals are the fastest and easiest way to submit documents. Some people still prefer sending them via mail, which is fine. But if there's individuals that identify as needing support, that we can do some sort of training to help them upload those documents via the county portals. I don't know if there's any questions or if I can move forward. All right. Partnerships with our, I mean, a lot of this is intertwined, some of the same kind of ideas of Central Coast is Alliance for Health is already identified those who are at risk of losing their coverage, and they are prioritizing outreach through, again, these campaigns, text messaging, literature. But again, if we were to ask for some of those documents and forms, I know that they have been willing to share that information with, you know, different agencies. So having those alignment, sharing that information. I know that some of our Office of Education are now kind of connecting those same messages and identifying areas and locations that people can go to complete these documents. Pop-up events. So anywhere that we know we send our ECM or CS clients to are ideal areas to have pop-up events. I know Salud para la Gente and CAB are going to be doing some pop-up events coming up in November to help with, you know, renewal. So if your agency is interested, please connect with one of your partner agencies and really support this idea of a pop-up event where renewal documents can be completed on the spot. I think that one of the things that is also very valuable is creating workflows or infrastructures within our ECM and community supports programs that have renewal as one of the important conversations that's being had. So again, creating a workflow that says, you know, at very specific steps, renewal is discussed. We're having to run eligibility regularly when working with ECM and CS anyway, and that can change from month to month, but the ability to say, okay, well, they are going to be renewed in a month. Let me see if I can do the paperwork with them now. And then again, pairing it with, you know, our food delivery. Someone was talking about they do the, you know, food delivery service, having there be some literature that you provide with and you deliver the food, or, you know, in the rental assistant packets, to really see and hear this everywhere and not feel like, you know, they're only hearing it from one place. If you have an EHR, and many of us do, having the idea of flagging or creating some systems where it identifies where our patient, when their renewal is due, is also an ideal thing, so that when they do come in for their visit, it's flagged. It's another way of kind of remembering, okay, let me talk to them about renewal and how we can support them. I think that addressing all barriers is, it's in my DNA, but it's also probably in many of your DNA because we're doing this work. But language, transportation are and childcare are three very important points to getting things done, to supporting our community. So having the ability to hear the message in your native language is so important. And many of our local community members, you know, may speak Mixtec or Triqui. It's not a written language, so many of us have now started utilizing QR codes to support the education being out there. But then also having interpreters that are there to help someone complete those documents is also pretty important. We identify that maybe someone has a transportation issue, providing them with a taxi voucher, providing them with, you know, a bus pass. And again, if we're doing a pop-up event, if we're having a meeting and there's need for childcare, making sure that the childcare is there. And really, trust is important, right? And in a community that's already dealing with fear, making sure that this is less about the immigration piece, even though it does have a lot to do with it, and more about making sure we're renewing our insurance. All right. Driving this point, social drivers of health screening tools. We do them often. We do them regardless of what kind of agency we're working for, identifying what the needs is, if it's food insecurity, you know, if it's transportation, you know, whatever the case may be. There's ways that our agencies are supporting the community, and we really just need to lean heavily on our community health workers and our promotoras, and this idea of a warm handoff, identifying very concrete agencies that support, that are nearby, and having, you know, someone they can quickly call and schedule an appointment, or walking them over. I mean, a lot of the grassroots work is going to be so important to making sure that we keep our clients, our patients, our community members safe, and also making sure that we're still able to provide these services for them. And then again, the messaging across all counties, across all agencies is so important to this work. If there's anything that I could say just on a basic level, is for us to make sure that our community is checking their mail. A lot of times we find that, again, general statements, but we find that our community isn't always checking their mail. They're so busy, they're working, they're exhausted, so they may wait, you know, Sunday afternoon to open their mail from that week, or maybe a few Sundays go by before they actually get to their mail. But making sure that we're telling our community, this is very important during these times between now and December 31st, that we have you check in your mail and understand your Medi-Cal timelines. And so if you're getting your redetermination form, 2 months ahead of time, let's already have something scheduled before, we get to the end of that 2 months. And then scheduling that appointment. So not only should we help them understand the importance of checking their mail, but also helping them schedule that appointment with a FQHC or with a community partner in order to address those literacy issues, in order to help them complete those forms. Some of the agencies currently and locally that are helping are like Salud para la Gente, Community Action Board. 211 can also identify places. Clínica de Salud, Hazel Hawkins Community Health Center, and San Benito Health Foundation, as well as the Youth Alliance, are places where our individuals can go to get the support that's needed. All right, and I want to close this presentation with a reminder that equity is more than just a principle. It's the work that we do to ensure dignity and opportunity for all, right? And at the center of every policy and every decision are people, our community, our gente. And we have to keep humanity in focus. We have to create space for compassion and justice. We have plenty of challenges ahead of us. They're real, but together we can create courage and collaboration. And that is my reason for hope. So I don't know if anyone has any questions. You can jot down our contact information at admin@harmonyhealthgroup.org. I will stop sharing. There was a lot that was there, but really, again, streamlining, supporting each other, getting the message across in several different ways is going to be key to making sure that access to health is not a barrier.
Thank you for that, Darlene. I'll just note that Lynn dropped in the chat. Thank you for the timely presentation. Agree that a focus in Medi-Cal renewal should be top of mind for ECM providers. And even though she had to hop off, she's looking forward to receiving materials to review the rest of the presentation that she missed.
Absolutely. I don't know if anyone has any questions or ideas that they'd love to share. I mean, this is a learning circle, so I did some research on what Tri-County is being done, but I also would love to hear maybe what your agency is doing and how you're supporting this effort. I'm not meaning to put you on the spot, Steve, but do you all have any plans with messaging and in particular with ECM and community supports?
We're going to be holding some big meetings about these things because it is going to take kind of a higher level of planning to make sure that we're staying on top of these things and getting the message out and providing the right kind of care coordination that ensures that people are staying with Medi-Cal as long as possible and consistently without any lapses. It's all very disheartening, what's in store for us, but we're just gonna do the best we can, I guess.
Thank you. Anyone else want to share what their agency's doing, or maybe that they're starting to have these conversations again? We only have 3 months. And I know that people have started these conversations on how they're going to educate and kind of support. So please feel free to share. What about Mom's Meals? Mariana, is there anything that you'd like to share or things that your agency is thinking about, even if it's on an unofficial level?
You know, I don't know if I'm the best one to answer that question. I'm very much more on the community outreach, or just really going out and building awareness about the Moms Meals program and how individuals can be referred. But I know we really want to keep pushing, community supports and keep, bringing medically tailored meals to more individuals that really need these meals.
Yeah. Thank you. I appreciate it.
Thank you.
Again, I'm not meaning to put people on the spot, but I'm looking at our list. Does Cynthia maybe want to share? Cynthia Diaz from Health Project Center.
Hi, yes. I think I'm super happy to see that we're having these conversations. I know at our organization, it's been something that we've been talking about and trying to just really inform our case managers to really connect with the community, even if it's not our members, but just, hey, heads up, this is coming up. Because the more they're informed, the more likely they'll make those, submit all their paperwork and all that will still happen and we'll keep the ball rolling. So it's definitely, we're just trying to educate right now and really pushing forward in the communities that we're serving.
Yeah, so important. I think that hearing it everywhere is not going to be something that the community tires of. I think hearing it from everyone, especially with the text messaging that's happening through Central Coast Alliance for Health, and everything can complement each other. So thank you, Cynthia. Anyone else? Okay. Well, Berenice, it's all you then.
Okay, yeah. Trying to see. Okay, sorry. I was looking at one more thing. But I think that's all we had planned for today. I think, Memo, if you have the poll ready, we'd like to launch just a quick poll to get a sense of how the content for these sessions is being received. We really do appreciate and take into consideration feedback for as we plan future sessions. And as we have the poll kind of running in the background, we'd also love to hear if there are any topics that are top of mind for you all in your day-to-day work, things that you'd love to hear us bring forth for collaboration amongst partners, or even if it's around technical assistance or training needs, as we look to plan activities for the last 3 months of the year and looking into next year as well. And since we have the time, I'll also throw in a plug for our last 2 in-person events of the year. So on October 23rd, we'll be in person in downtown Santa Cruz hosting a provider resource fair. So if your organizations are interested in tabling, we've sent out a registration link where you all can sign up. And then on November 21st, we'll be having our CPI meeting in person in Watsonville at the Community Health Trust. So please mark your calendars and we look forward to seeing you soon. Okay, I see we have about half of folks completing the poll. So if you're still submitting your responses, feel free to stay on a couple more minutes and share. Okay, sorry, I'm catching up in the chat here, registration link. I will pull that in just a second, drop in the chat. But curious to see if folks have any topics they'd like to share. Feel free to come off mute and share with us.